5 minutes.
Thank you, Mr. Chairman, and thank you, Secretary Shulkin, for being with us. We're delighted to have you confirmed and get to work, and this is very big news that you've just announced about looking into an off-the-shelf IT program, and we hope we can move forward with you on that. I, too, want to speak about rural America. I just had a VA roundtable in the northern part of my district in New Hampshire, and I just want to quote real quickly a nurse, Carol Ann Jordan of Berlin, New Hampshire. She was there with her husband, and she just cautioned about all this care outside the VA. I don't want to see the VA medical centers close. I don't know where this VA choice card will take us. My concern is that the bonding of brother and sisterhood will be lost. They won't have the symbols, the flags, the stories, the jokes, crying together, laughing together. I am afraid that will be lost. And she was very eloquent, and I said, I wish you could have come here to testify. But how can you reassure veterans across the country as we move into this patient-centered care and the programs such as the one that we are about to test out in northern New Hampshire, the Coordinated Care Program, which I'm excited about, but how can we reassure our veterans that we won't lose the camaraderie of Veterans Administration care?
Yeah, this is a significant issue for us. This is not just the camaraderie, which we think is important, but these are the real expertise that we have in our VA healthcare system. Remember, we have 4 missions. The clinical care is what we always talk about, but we also have an education mission. We train more American healthcare professionals than any other organization in the country. We have research that's dedicated solely to the improvement of the well-being of veterans, and we also serve a national emergency preparedness role. So all 4 of these missions are very important to us. I would just say 2 things. One thing is we know from the Choice Program that only 5,000 of the more now than 1 million veterans who have used the program chose only to use the Choice Program. So they're saying exactly what your constituent told you, which is the VA is essential and important to them. But we are not going to allow this, the VA programs to be diluted. And one of the reasons why that's so important is that we need to modernize the VA system. Our lack of capitalizing the VA system in terms of the buildings, the equipment, the IT systems could make it a non-competitive system. But we're going to make sure that the facilities that are open are the best for veterans, and veterans are going to want to continue to get their care there. The community care program is a way to make sure that we supplement the VA in an integrated fashion.
Well, I think you have our bipartisan support about providing the access, but it was just a reminder on making sure we keep that veteran-centric focus that we all have. I just want to speak briefly. I'm the founder and co-chair of our Congressional Bipartisan Task Force to combat the heroin epidemic, and I'm very concerned about opioid substance use disorder, particularly in the context of opiates from surgery or high rates of opiate medication being used for pain management. Could you comment on what's being done in the VA? And I would like to work with you going forward in your team to work on pain management techniques that would reduce the use of opioid medication and treat addiction and substance use disorders for our veterans.
Yeah. We recognize and understand that this is a public health crisis, not only in the VA, but across America. VA recognized this as a crisis in 2010 before there was a lot of attention across the general media. And we started a campaign with a number of strategies to reduce opioid use. I'm pleased to say that we've reduced opioid use by 22%. We've done it by involving our patients. Patients have to use informed consent to start these medications. We do academic detailing to our physicians. We do use information systems to be able to prescribe, to be able to help remind providers of other alternatives. We've built up complementary care. We coordinate with the state prescription data monitoring programs. So we're doing a number of things, and frankly, places around the country are coming to us to learn how we've done this. So we'd be glad to work with you. We think that there's much more to do, and developing research in alternative pain management strategies is clearly one of our priorities right now.
Terrific. We look forward to working with you. Thank you. I yield back.